Welcome to my presentation. Yes, giving childbirth to new offspring is very special event in our life. Yes, if we are handled that giving birth with in a proper skilled manner means we can able to save the mother and the baby's health in an effective manner. Yeah. So that giving childbirth, labor is otherwise known as childbirth. That is divided into 4 stages. That is first, second, third and fourth stages. In that, here we are going to deal with the topic of active management of third stage of labor. Yes, what is that third stage means? It is begins with the delivery of the child ends with the delivery of the placenta. Yes, myself, Mrs. R.Pramila, completed MSc Nursing, working as an assistant professor in ES College of Nursing. So, introduction in this. So, third stage is the most crucial stage of labor. Third stage of labor is characterized by the separation of placenta and its expulsion. Yes. Third stage of labor lasts from the birth of fetus until the placenta is delivered, is known as third stage of labor. So, what is the definition of this third stage of labor? Third stage of labor is a stage which begins after expulsion of the fetus and ends with expulsion of the placenta and membranes, is known as third stage of labor, is otherwise known as afterbirths. So what is the duration for this means? It is averagely from 15 to 20 minutes in primigravida. What is that primigravida means? The mother is first pregnant, and 5 to 10 minutes for multipara. So multipara means the mother is giving birth more than one. And then the duration is however reduced to 5 minutes in active stage of labor. That means active management of, with the hands of active management, we can able to reduce the overall minutes into 5 minutes. And then duration for here, so the may be as short as 3 to 5 minutes. Although up to 30 minutes is considered within normal limits. Yes, the risk of hemorrhage increases as the length of third stage increases, so that we can able to handle the third stage of labor in an active manner means we can able to prevent maximum occurrence of hemorrhage. What are all the events will take place in third stage of labor? There will be placental separation, separation of membranes, expulsion of placenta, mechanism of control of bleeding. These are all the events will take place in the third stage of labor. Yes. So what is the mechanism of separation of placenta? First is progressive uterine contraction. So with the help of progressive uterine contraction, placenta will get detached from the uterine cavity. And then with the help of decrease in the area of placental attachment due to increased contraction of the uterus, there will be decreased room space in the placental attachment area, that is in uterus. And then also inelasticity of the placenta cannot keep in pace with such diminution. So in that decreased room space, the placenta can't able to live, that is placenta can't able to remain back at the uterus, so that it will automatically come out from the uterus. And then buckling and separation, ultimately it will lead to cause separation of the placenta. Yeah. And the two ways of placental separation are central and marginal separation. So central separation is otherwise known as Schultz method and marginal is otherwise known as Duncan method. So here the central separation, detachment of placenta from its uterine attachment starts at the center. Yeah, by name itself we can able to understand the concept. So here the placenta is getting separated from the center, and here marginal separation starts at the margin. That's why it is named as marginal separation. So marginal separation is found more frequently. Yeah, with the help of gush of bleeding we can able to identify the marginal separation of placenta, that is Duncan method. Fine. So here you can able to differentiate the pictures from this to that type of placental separation. So in the Matthew Duncan method we can able to see here in the beginning of third stage of labor there is no any detachment, and after that placenta separate from the peripheral. Yeah, peripherally, marginally the placenta is getting separating, so that we can able to visualize in the PV examination. We can able to identify trickling of blood here, and then in the upper segment contracted, placenta also separated. So this will lead to cause automatically the separation of the placenta here. And in case of the Stultz method, so in the beginning stage of third stage of labor, looking like this, after that placenta in lower segment. So here the placenta is getting separated centrally. After that, and end of the third stage of labor, there is no placenta inside the uterine cavity. Yeah. Signs of placental separation. What are all the signs we can able to assess the placental separation means? First sign is sudden trickle or gush of blood. Yeah. So far the mother and the baby was connected with the placenta. Placenta helps to deliver the blood from the mother to fetus. So here there are number of arteries are attached to the placenta, so that the placenta will receive the blood from the mother and that will circulate to the baby. So in the third stage of labor there is no baby, so that the placenta is getting separated from the uterus. So automatically, so far the blood is reached in the placenta, no, that blood will be come out from the uterine cavity. And then lengthening of the amount of umbilical cord visible at the vaginal introitus. Yeah, automatically we are cutted and removed the baby from the placenta, that is from the umbilical cord, so that here automatically the placenta is separating, means that will get descend over the lower uterine cavity, so that it will lead to cause lengthening of the amount of the umbilical cord. And then change in shape of the uterus from discoid to globular. Yeah. So in previously we have seen, no, here the placenta is getting separating, so that the automatically the upper segment of the uterus will be changed. So that is the shape changing from discoid to globular. Fine. And change of the position of the uterus also will be changed because of the traction movement felt by the given by the placenta. Expulsion of the placenta. So placenta is expelled out either by voluntary contraction of the abdominal muscles and or it by manipulative procedures. If the placenta is not separated manually, that means the placenta is voluntarily separated from the uterine cavity, means we can able to deliver the placenta with the manipulative procedures. Yeah. And then management of third stage of labor. Yes, this is what our topic we are going to study. So here third stage is most crucial stage of labor. Yes, we all know. And previously uneventful first and second stage of labor can become abnormal within a minute with disastrous consequences. We are not managing the third stage of labor in a proper manner, means the first and second stage of labor also will happen good manner, but we are not managed third stage of labor in a proper way, means definitely it will lead to cause disastrous consequences. So that we should handle and we should manage the third stage of labor in a very effective manner. Fine. So what are all the principles we need to follow when we are managing the third stage of labor? Here first is to ensure strict vigilance. We should follow strict vigilance, and then to follow the management guidelines strictly in practice, so as to prevent the complications. Yeah, especially the PPH. So we need to maintain and we need to follow the guidelines which was already formulated. Then what are all the rule of management here? Do not massage the uterus before placental separation. Yes, we should not give fundal massage. If we should not touch the abdomen if the placenta is not separated. If you are find the placenta is separating with the help of signs of separation like gushing of blood and cord lengthening, changing in the shape of the uterus, then only we need to do a massage. Until we should not give any massage to the uterus. And do not pull the umbilical cord before the placenta separates. Yes, if we are pulling the cord before the separation of the placenta, means that will lead to cause inversion of the uterus. So in order to prevent that, we need not to pull the placenta. Yeah. And then do not try to deliver the placenta before its complete separation. Yes. So if the placenta is separating, means we should not deliver the placenta before its complete separation, and wait for the natural process to occur and do not interfere. We should give adequate time to separation and we should wait and watch the signs of separation. After that only we need to manage. And steps of management. Here there are two steps. Expected management and active management we need to do. So what is the expected management? What are all the things we need to carry out means, first, minimal assistance. Yeah, we should give adequate time for natural occurrence and we should watchful wait. Then we need to give minimal assistance for the effective management of third stage of labor. And then constant watch and never leave the mother alone. Yeah, we need to monitor the vitals and we need to check it out the PV bleeding. So, for the assessment of these factors, we need not to leave the mother alone. And catheterize if bladder is full. Yeah, we need to empty the bladder. The empty bladder is very, very important for the descending of the placenta. Yeah, if the bladder is full means that will occlude the way of the that means occlude the genital tract, so that the placenta is come out. So that we need to catheterize the bladder. And keep the hand over fundus to note the uterine activity. Yeah, whether the uterus is contracting or not. In order to rule out that, we need to always keep the hands over the fundus to assess the uterine activity. And wait for spontaneous expulsion. If there is no bleeding up to 10 minutes, we need to wait for spontaneous expulsion. And if fails to expel, go for assisted expulsion. That is, we need to give fundal pressure and controlled contraction, that is modified Brandt-Andrews method. Here what is that controlled contraction means, we need to give mild traction over the umbilical cord. At the same time we need to give opposite traction to the suprapubic region so that we can able to prevent the inversion of the uterus. And examine the placenta and membranes for their completeness. If the placenta is separated fully, then we need to check for completeness of the placenta in order to rule out whether the bits of placenta is retained inside the uterine cavity or not. Why we need to rule out that means, we can able to prevent the PPH. Yeah. And then inspect the vulva and perineum for injuries to be repaired, and episiotomy wound is sutured. So we need to inspect the vulva. So what is that vulva? Vulva means external genitalia. We need to check it out. And perineum for injuries. If any anal tear or there or urethral tear or there, we need to check it out. If there is present means we need to repair. We need to give suture over the tear area. And clean the wound with antiseptic lotion and keep sterile pads. Why we need to do this? Yes, we are dealing with the internal organs. So internal organs is contaminated means automatically that will lead to cause sepsis. So sepsis will lead to cause so many problems. In order to prevent that, we need to clean the wound with antiseptic lotion and keep sterile pads inside the uterine cavity for the absorption of the blood. And then maternal condition, check pulse, blood pressure, behavior of the uterus and any abnormal vaginal bleeding for 1 hour. So after the placenta delivery, we need to observe the mother until 1 hour for the assessment of behavior of uterus, that is whether the uterus is contracted or not. If the uterus is not contracted means what will happen means, so vessels will be more dilated, so that will lead to cause more bleeding. So in order to prevent the bleeding, we need to always promote the uterine contraction. So uterus to be contracted, and automatically the contracted uterus will not bleed much more. And then send the mother to ward if condition is stable. Mother is stable, all the vitals are stable means we can send the mother for ward. And then active management. So here, so in the active management there are some principles. First is exit powerful uterine contractions, which facilitates not only early separation of placenta but produces effective uterine contractions following its separation. So what is here? We need to excite, we need to improve, we need to develop the powerful uterine contractions that will facilitate not only early separation of the placenta but produces effective uterine contraction following its separation. This effective uterine contraction is important for prevention of the PPH. And three main components of AMTSL. What is that? AMTSL means active management of third stage of labor. Here there is mnemonic to remember the three main components of AMTSL, that is ICU. So what is that ICU? Means I stands for injection of oxytocin. Yes. So oxytocin is a uterotonic agent in order to promote the uterine contraction for the prevention of further bleeding in the third stage of labor. So in order to prevent PPH, we need to give oxytocin of 10 international unit of the lateral thigh, in the lateral thigh of the mother within 1 minute of childbirth. So that will helps to promote the uterine contraction and automatically prevent what is that? PPH. Fine. And next letter is C. So C stands for controlled contraction. So here controlled contraction means if we are noted down the placenta is getting separating, that is gushing of blood, cord lengthening, suprapubic bulging and changing in the shape of the uterus. We are noted means, so that is placenta is getting separated. So then we need to do controlled contraction. If what we need to do? We need to pick the umbilical cord and we need to give mild traction. At the same time, we need, with the help of indominant hands, we need to give suprapubic pressure against the cord traction. So when we need to do this means when the uterine contraction is present, then only we need to do controlled contraction. Yeah. And U stands for uterine massage. So what is that uterine massage? In order to promote the uterine contraction, we need to give fundal massage. So fundal massage will promote the uterine contraction. So uterine contraction will promote the vasoconstriction of the placental site vessels, so that automatically the bleeding will be arrested. And then, so CCT, here you can able to see the natural picture of the CCT. So first, if you identified the placenta is getting separated means, then we need to give likewise. So we need to hold the umbilical cord with the help of dominant hand, and with the help of indominant hand we need to give suprapubic pressure. And then the next step is placenta is visualized means we need to receive the placenta and then we have to look for completeness of the placenta. So why we need to check the completeness of the placenta? In order to rule out the retained bits of the placenta, and that will prevent the PPH. And what is the advantages of these means? Minimizes the blood loss in third stage of labor approximately 1/5 and shortens the duration of total active third stage of labor. And disadvantages of that, slight increased incidence of retained placenta also will take place. And then, so procedure for the recalling, first injection of ergometrin, that is about 0.25 mg, or injection of methogen 0.4 mg, or we can give injection of oxytocin 10 international unit given IV following delivery of the anterior shoulder, and then placental delivery by controlled contraction after delivery of baby availing first uterine contractions. And then if it is fails means wait and repeat procedure after 2 to 3 minutes. If that also fails means wait for 10 minutes, repeat the procedure again. After that also fails means we need not to wait, then we need to do the manual removal of the placenta. So we need to note that CCT is not designed to separate the placenta from the uterine wall, but to facilitate its expulsion only. Yes, expulsion only will be helpful with the help of CCT. If the birth attendants keep pulling on an unseparated placenta, inversion of the uterus may occur. What is that? Turning of the uterus inside out. That is termed as inversion of the uterus. And then here you can able to see the manual removal of placenta. Yes. So under the general anesthesia, we can remove the placenta like this. So yes, a truly great midwife is hard to find, difficult to part with, and impossible to forget. Yes, we need to do our job with the full-hearted. And what could be more beautiful than bringing new life into the world? Yes, we should do. And thank you finally. I hope the class will be useful for you all. Thank you.